Tonight's webinar again will be presented by Dr. Majdee Islam, a board-certified urologist and men's health specialist. Dr. Islam, thank you for your willingness to be here with us this evening to share this important education with men in the St. Louis community. I want to also mention that we have a patient champion with us tonight, Cliff, who after Dr. Islam is done presenting will get to share his experience in his ED journey, and we'll be really happy to hear from him, and you're welcome to address questions to him as well. So Dr. Islam, I will go ahead and turn it over to you to get things started for us.
Perfect. That sounds great. I appreciate the introduction. And then actually, Sean, if I've got everything pulled on my side, I can share my screen, if that's easier for you now that it's
sure. If you want to, sure.
Yeah. Oh, you know what? It told me I can't secure it. Oh, let's try it again. I apologize. Oh, it says it's disabled. That's okay. In that case, I'll just use yours.
All righty. There we go.
Okay. Well, yeah, so my name is Majdee Islam. Like Shauna said, I'm a urologist in St. Louis. St. Louis, a couple locations where I practice out of. One of them is in the St. Louis side in West County, and then I go out to Alton and View Heights on the Illinois side. I specialize in men's health, which involves erectile dysfunction as well as testosterone, overall sexual dysfunction, including Peyronie's disease, as well as fertility. I was born and raised out here. I did my training out west in Colorado and then UCLA, and then I moved back home to start practice. So today I wanted to talk about erectile dysfunction, including just the general, what is erectile dysfunction, the pathophysiology, and then most importantly, the treatment options that men all across the board have about erectile function. And, the big thing, going on to the next slide, the big thing with erectile dysfunction is more common than most guys think. So as high as it seems, 20% of guys, 1 in 5 guys, 20 and older has some aspect of erectile dysfunction, and over half of guys over the age of 40 have some aspect. The important thing with erectile dysfunction is knowing that it's not necessarily the inability to get an erection, period. It's the inability to have an erection that's rigid enough or that lasts long enough, in general, isn't enough for sexual activity as defined by each guy, meaning just because you have an erection doesn't necessarily mean you don't have erectile dysfunction. It could be it's not lasting long enough. It could be it's not as rigid as you want it to be or it used to be, or not rigid enough for sexual activity. So the important thing to note, I think, from this slide is erectile dysfunction comes in all different colors, if you will, or shapes and sizes, if that makes sense. And it's more common than most guys think. And so with erectile dysfunction, the main issues revolve around blood flow as well as nerves. And so when the nerves are stimulated that affect erectile function, there's muscle relaxation around these blood vessels in the penis, within the penis, and what's called the corporal bodies. Those muscles relax, blood flow comes into the penis, and you get an erection. And those blood vessels then, they compress the veins that are around the corpora that don't allow blood to leave the penis. So essentially, long story short, you get blood flow in the penis, it doesn't leave the penis, and then once you are erect and use the erection to your satisfaction, oftentimes with ejaculation or orgasm, you have the muscles contracting to lose, or the erection goes flaccid. And so with the next slide here, the causes associated with the lack of blood flow and or the issues with stimulation are pretty widespread. And I usually tell my patients it's multifactorial. There's usually not one specific thing that's going on that's causing the erectile dysfunction. That being said, the main risk factors are across the board, age, smoking, diabetes, hypertension. The 2 biggest things on the list of risk factors are diabetes and then some kind of vascular issue, some kind of blood flow issue in the body, whether that's heart disease, high blood pressure, high cholesterol. Those things are, far and beyond the most common factors. There can be certain medication factors as well. Oftentimes prostate cancer treatment also can be a pretty significant factor if that's something that's in someone's history. But the main point here is oftentimes guys have multiple things that they're checking on the list of boxes in terms of risk factors that are causing the ED. So erectile dysfunction, it's not just a physical issue. There's a ton of studies, a ton of data out there that shows, and most guys could tell you that have erectile dysfunction, it really affects you psychologically. So it can cause issues in terms of self-esteem, anxiety, depressive symptoms. There's studies that show that literally men with erectile dysfunction suffer from higher rates of depression than men that don't, which makes a lot of sense. And most importantly, or maybe a significant importance, is it affects relationships pretty significantly too. Men with erectile dysfunction find that they aren't able to get as intimate with their partners, not just physically, but also emotionally, which causes relationships to really take a hit oftentimes. And so, in terms of treatment for erectile dysfunction, penile implants is, I tell guys it's the most effective, but also the most invasive way to treat erectile dysfunction. And so, the important thing with with the implants is it's going to work, meaning it's going to give you an erection, and most patients, as well as their partners, are quite satisfied with the implant, with the pump, with being able to restore their erectile function surgically with a penile implant. So going into the risk factors a little bit with diabetes, on this next slide, the most important thing with diabetes is patients are usually having worse erectile function with diabetes, and they're not going to be as treatable as counterparts without diabetes in terms of oral medication. So guys with diabetes oftentimes have a more severe erectile dysfunction, and it doesn't respond as well to things like Viagra or Cialis. And so unfortunately, with diabetes, the reason is because it affects not only the blood flow to the penis, the blood vessels, but it also affects the nerve endings, and it hits kind of both of them at the same time. Whereas often with the other vascular issues, you're really just getting a blood flow problem. And in the diabetes patients, I have guys that come into the office that haven't seen a physician in quite some time for erectile dysfunction, and we find out that they have undiagnosed diabetes. So it can oftentimes be the thing that brings you into the office, but it can be the presenting factor or the presenting symptom for diabetes. So with diabetes, the reason again is because of these nerve endings. So the nerve endings take a hit. There's axonal degeneration is what we call it. Long story short, with erections, usually you have to have some kind of stimulation of the nerve endings. Because the nerve endings are taking a hit in guys with diabetes, the Viagra, the Cialis, the erectile function medications aren't able to stimulate those nerves as well as they should, and so they're not going to be as effective for guys that have diabetes. So, things that can potentially cause cause erectile dysfunction in men with diabetes: men that are older, men that have poorly controlled diabetes, A1Cs that are around 7.5 or higher are more likely to have ED than those that aren't. And then other concomitant factors like having vascular disease along with diabetes, or heart disease along with diabetes as well. So heart disease. With heart disease, this I think is a big take-home factor. Men with erectile dysfunction, or men that come in with erectile dysfunction, can oftentimes be 2 to 3 years out from developing heart disease. In other words, if you have erectile dysfunction, the blood vessels are quite a bit smaller than the blood vessels in the heart. And so those blood vessels that take a hit with erectile dysfunction are going to take a hit earlier than the ones with heart disease, because if you think about it, with diameter being a little bit bigger, it takes a little bit longer for those vessels to get clogged. So a lot of times men with ED come into the office and are diagnosed with erectile dysfunction a couple years prior to finding out they have that they have a heart disease. So the biggest thing with this, or the take-home point with that, is if you got ED and you haven't seen a physician or seen a primary care doctor, make an appointment, because we want to make sure that we're not missing some kind of heart-related event in the future. And I might have put the cart before the horse here in terms of the next slide, but it talks about the arterial diameter there, and like you can see there, the blood vessel to the heart is almost twice the size of the blood vessel to the penile artery. So you're going to see the problem with erectile dysfunction come out quite a bit sooner than when you're diagnosed with heart disease. So again, getting checked out is quite important, because just because you haven't been diagnosed with heart disease doesn't mean it may not be coming down the line, and it can be preventable by getting it treated more quickly. So reducing risk, anything that any doctor has ever told you to stay healthy. So exercise, diet, smoking, drinking, things of that nature are all going to reduce the risk not only of heart disease, but also improve potentially the erectile function. So you can improve erectile function with improving the other risk factors or diagnoses that are going on. So testosterone, we'll touch with this briefly. So testosterone and erectile dysfunction can sometimes go hand in hand. Low testosterone causes symptoms like fatigue issues, energy, feeling like you're having brain fog, sometimes having issues with libido, but also sometimes erectile function. Oftentimes in my patients in clinic, when there's not any other risk factors for their erectile dysfunction, I'll check a testosterone to make sure we're not missing something there. And testosterone is more, or having low testosterone is more common in men that are obese, men that are diabetic, etc. So again, symptoms of testosterone can be pretty widespread, but the most common ones are issues with sex drive, libido, ED, having issues with mood swings, obesity, issues with putting on muscle mass, etc. So how to treat low T? I'm sure most guys have heard commercials on the radio or seen things online, but injections are a common treatment. So doing injections in the thigh or the belly fat, basically in the muscle, there's patches, there's creams, there's gels, there's also pills that can treat it, where, concomitantly with taking something like Cialis or Viagra, I have a lot of my guys that are on testosterone as well to try to mitigate some of those symptoms. Prostate cancer. So whether it's radiation versus surgery, the prostate cancer treatments hit erectile function by affecting the nerves as well as the blood vessels. So similar to diabetes, you're taking kind of this two-prong hit to affecting erectile function. Oftentimes, you have a decrease in erectile function with prostate cancer treatment, but that it can improve, especially with surgery. However, so it can take quite some time. It can take up to a year and a half to go back to where your erectile function was prior to having at least prostate cancer surgery. With radiation, that process can potentially take even longer. So that's something important to note, that prostate cancer treatment can and likely will affect your erectile function. The question is how long it'll affect it, and if the erectile function will return. So with the surgery, you can see here in these pictures, essentially the prostate is completely cut out, and then the urethra, the P channel, is sewn back together from the bladder to where the prostate was. And the most important part about that is the nerves. I think this is on the next slide. The nerves that affect erectile function are, I lied. The nerves that are, I guess it talks about it, but they're right underneath the prostate. And so we oftentimes will try to do what's called a nerve sparing technique. We'll push the nerves down off the prostate to try to spare those nerves. Even with sparing those nerves, the erectile function can take a bit of a hit. And so, again, with prostate surgery as well as radiation, despite doing a nerve sparing technique, you can have some decrease in erectile function. Sorry, go ahead. And so about 50% of guys are going to have some aspect of erectile dysfunction after having even a nerve-sparing prostatectomy, nerve-sparing surgery. Even with guys, surgeons that do hundreds of surgeries a year and do multiple nerve-sparing techniques and have excellent outcomes, even with the best nerve-sparing surgery, you still oftentimes will have some aspect of erectile dysfunction. So Peyronie's disease. I treat quite a bit of Peyronie's disease. It's tough in terms of, the chicken and the egg with Peyronie's disease. So Peyronie's disease is a curvature with an erect penis. So with an erection, you have some kind of curve. It can be upwards, downwards, to one side or the other. And that curve is from a piece of scar tissue that forms in the lining of the penis. So whenever you're flaccid, when you don't have an erection, you don't notice it. But then when you get an erection, that piece of scar tissue isn't allowing the erectile tissue of the penis to expand in that one spot, which then causes curvature. It's not cancer, it's a piece of scar tissue. So a lot of times guys will feel this area of scar and worry it's cancer. So the good news is it's not something dangerous. The bad news is it'll affect the erectile function. And when I mentioned the chicken or the egg, the question is, if someone had erectile dysfunction, oftentimes the penis isn't as rigid, and sometimes that scar tissue can form from bending of the penis during intercourse, and that bending can then cause the plaque to build up. However, having a Peyronie's disease can affect the expansion of the corpora of the penile tissue. So that in and of itself can also cause erectile dysfunction by not getting as much blood flow to the penis. So sometimes it's tough to know whether it's the Peyronie's that came first or the ED that came first, but they absolutely do come hand in hand. And so, going on to the next slide, there's definitely treatment options for Peyronie's, which include sometimes trying some oral medications, there's surgeries, and also there's penile implants. There's something called Xiaflex. I'm sorry, it's collagenase basically that we inject into the scar tissue that oftentimes can decrease the curvature as well. So there's options for men with Peyronie's disease that are also non-surgical that can help straighten the penis out. And sometimes in certain situations, if you have pretty severe version of both, surgery is an option, including a penile implant. So, well, I'm sorry, I kind of addressed this and I apologize. So long story short, with both of these, there's options for patients, including treating the erectile dysfunction and the Peyronie's disease if it's severe enough with a penile implant. I'm so sorry, go ahead. Okay, so treatment with ED. So there's a wide variety of treatments, which include things that are as simple as taking a pill all the way up to a surgery like a penile implant. What's important is you don't necessarily have to go to a urologist to start getting treatment, especially if it's on the conservative end. You can absolutely see your general practitioner to try some Cialis or Viagra or something like that. It is important, though, that if Cialis or Viagra doesn't work, or if your primary care physician doesn't feel comfortable with that, absolutely see a urologist, see someone that specializes in ED, or even someone that's fellowship trained like me that, 70% of my practice is ED, so you can get a decent, well, evaluation workup as well as a conversation about the treatment options that make the most sense to you. And so this next slide kind of talks about all the potential options, and I'll talk about each of these here in detail, kind of one after another. So this next slide talks about basically overall lifestyle changes. We've talked about this before, but lifestyle, diet, exercise, smoking, drinking, things that you of course know about that can improve your health in general, can also improve your erectile function. So improving your lifestyle is something I talk to all my patients about, no matter who you are and how severe your erectile function is. And there are some patients that can have some psychologic aspect to their erectile dysfunction. They have no problems with masturbation, no problems with getting to orgasm when there's not a partner around, but then with a partner can have more issues. And sometimes even therapy can help with that. That being said, the first option is pills, so Cialis, Viagra, etc. These are common. They're easy because you just take them orally. And they can be quite effective in men. However, there's some men with more severe erectile dysfunction, men with diabetes, men with prostate cancer issues, where the erectile dysfunction medications aren't as effective. And on top of that, they can be somewhat annoying. There's the most common symptoms in terms of side effects are headaches, heartburn, sometimes some muscle spasms or upset stomach. And if you have heart disease, there's certain types of medications called nitrates that aren't as effective, or that are contraindicated to do with Cialis or Viagra. So a vacuum erection device, this is a glorified penis pump. So the idea is you're taking a cylinder, putting it on the penis. You take this vacuum suction that brings blood flow in the penis, and then you essentially take a band that goes to the base of the penis to trap the blood flow in there. The positive is it's 30 to 40% effective. It's not invasive. It's pretty straightforward to do. The negative, though, is it's somewhat uncomfortable. It can decrease penile sensation. It's not the most spontaneous thing in the world either. And so I have a decent amount of guys that do it that have good success. I'd say majority of my guys try it and then move on, if you will. But it's definitely an option and not a terrible option either. So intracavernous injections, ICI is what we call it. I explain this to my patients as, think of it as a very, very potent liquid version of Cialis or Viagra. It's not exactly what it is, but that's the idea. And what you do is you're drawing up the medication from this vial and injecting it into the side of the penis. It's pretty effective. It's usually ballpark around 80 to 85% effective for all comers, where we can find a dose eventually that gives you an erection that's rigid enough for penetration, lasts as long as you want to. You would do the injection about 5 to 10 minutes prior to sexual activity. So the negative is, A, it's a needle. So you're taking a needle, you're putting it in the side of the penis every time you want to have an erection. But B, it's also not the most spontaneous thing in the world, but it's sometimes also a little bit uncomfortable with taking a needle to the side of the penis. And there's some risk that you can have an erection that lasts too long with the medication. I have quite a few of my patients that are on this, and most of them are quite happy. The one caveat, of course, is it's a needle. Some guys get tired of the needle. Some guys don't love using the needle, but also over some time, it can be somewhat, you can require more of the medication to have similar effects. I'd say it's pretty popular with my patients. So penile implant. So this is a surgery basically where I'm taking a device, an implant, and placing it into the penis. It's an excellent option because it's going to be effective essentially about 95 to 100% of the time. You're going to get this implants these implants surgically placed into the penis and into the scrotum, and you use a pump to pump up the penis in order to get an erection. The erection is as rigid as you want it to be. It lasts as long as you want to. It's nice and spontaneous because it takes about 30 seconds to pump this thing up. And then once you're done, you hold this button that's on top of the pump to get rid of the erection. Now, I tell guys this would be the last option because you can't go backwards from an implant. You can't go back to taking pills or doing injections, and it's a surgery. And so the surgery does entail going through a process where you're having a surgery in a pretty intimate part of your body. There's also risks that include, and I'll talk about this in more detail, but risks including infection, malfunction of the device, post-operative recovery, so discomfort afterwards, things of that nature. But what I'll tell you is most of my patients that end up at this point usually have tried the other things. But most importantly, they once they go through the healing process, they're pretty darn happy. They are able to get an erection spontaneously. It looks and feels like a normal, natural erection. And most of my patients, I'd say pretty much almost all my patients, are pretty happy with the decision. And going on, I'll talk about in a little bit more detail the idea. So there's three main implants. The one that well, I'm sorry. There's two main types of implants. One of them is just a one piece, meaning it's just the cylinders that kind of bend up and down. There's no pump. It just keeps your penis semi-rigid or semi-erect. And then there's the inflatable penile prosthesis. There's what's called the MS pump. That's the one on the left there. That one's been around for a long time. It's kind of our think of it as the Toyota of the implants. Of the pumps. And then you got the newest pump. It's called the Tenaccio. It's updated. It's got a little bit more ease in terms of being able to pump it up. There's grooves that help you find the pump. It's easier to deflate. And so overall, we have the two different pumps. To be totally frank, there's no right or wrong answer, but we lean towards trying to do that newer pump because most guys find that from a dexterity standpoint, it's quite a bit easier to use. So the nice thing with the AMS 700, the implant from Boston Scientific, is the inhibizone. So one of the most important risks of the penile implant is infection. There's a risk of infection with the penile implant, with any kind of implant surgically, where if an implant gets infected, the frustrating thing is the only way to get rid of the infection is to remove the implant. The inhibizone is basically a mix of minocycline and rifampin, two types of antibiotics that's encased, if you will, into the implant to essentially reduce the risk of infection. There's studies that show that it reduces the risk of infection. The other thing with the implant is it's designed to try to emulate or be as similar to a normal natural erection as it can be. And so by following the lining, if you will, of the penis, it gives you this nice natural feel to allow for a nice natural erection. And then if you click this video, it'll kind of take you through real quick a schematic of how to pump this implant pump. So if you take a look here and then actually give it a minute. Actually, there you go, perfect. So there's the penis and a scrotum. Basically, this is almost like taking an X-ray. You can see that the scrotum has the pump that's down in between the two testicles. You pump this pump to be able to inflate the implants, meaning there's saline that goes through this reservoir that's behind the pubic bone to inflate the implant. Then once you're done with the erection, there's a button that you press to deflate the implant. So it takes the fluid out from the cylinders back into that reservoir. That reservoir is surgically placed behind the pubic bone in an area where you can't feel it. It doesn't, when you bend over, if you move, you don't know it's there, but it stays there. It keeps the fluid in place so that it can't leak out. And long story short, it's a part of the implant that you never actually know is there. And this is the same video, sorry. Here you go, okay. And then we can go on to that next. Oh, and this is Carmen's. We can skip this. This is essentially the same thing, but with a real person. We can skip this one. Perfect. Okay, so the procedure, usually the way that I do the procedure, I have you come in to the hospital to do the surgery. I can either have you go home afterwards, or I keep you overnight for one night. It's overall an outpatient surgery where it takes me about 45 minutes to an hour to do the actual surgery itself. I make an incision on the scrotum, basically down near where the penis meets the scrotum. And then after that hour and a half, you either wake up and you go home, or you go home the next morning. Usually I tell guys to take it as easy as you can for a couple of weeks in terms of major physical activity. And then you can go back to usually your normal activity around 3 or 4 weeks. In terms of using the implant, I usually have you wait about 4 to 6 weeks prior to being able to have sexual activity with the implant. So cost. Long story short, the implant is usually covered by insurance. Most insurances will cover it, including Medicare, which is fantastic. But we always figure out if the implant is going to be covered. And what I usually do is I run it through insurance first prior to having you make any decisions or scheduling surgery. But the nice thing is, as crazy as it sounds, even though injections and pills oftentimes aren't covered by insurance, the implant more often is, which is fantastic. So, there's what's called edcure.com. It's a website where you can go to learn not only more about the implant, but also get some, some real life experience with men who have will have had implants and share not only their experience, but their partner's experiences about the implant. There's also something called the Hard series that we've came out with, which has these videos of implanters as well as patients that have gotten the implant, which is fantastic. So you get this look into their stories as well as looks into their surgeons and kind of this relationship that they have, but also their experience with the implant. That being said, I'd love to turn it over to Cliff, who's here today to talk about his experience with having a penile implant. And then after that, I'd love to answer any or all questions that we've got.
Awesome. Thanks, Dr. Islam. I'm just going to remind everybody, since I was sharing my screen, I wasn't able to type this in the chat box. I normally do, but just a reminder to all of our attendees, if you have questions that you would like to submit to Dr. Islam or to Cliff, please just type those in the chat box at the lower part of your screen. Your name will remain anonymous, but we'll get to those questions at the end of our talk here. All right, Cliff, it's all yours.
Well, thank you very much, and good evening, everyone. Basically, what you're going to hear is the journey that I took with my wife from the time I was diagnosed with prostate cancer all the way through conquering ED. And the story is very simple. When I was 58, I was diagnosed with prostate cancer. And being who I am, I decided, even though it was slow growing and a very little spot, I decided to have it removed. Once I had it removed, I went back to my regular physician after I'd say about 4 months, and said, well, I'm not getting erections. He said, okay. He said, we'll put you on some great pills. And they put me on Viagra. Unfortunately, I was one of those people that got headaches that were so bad that I just had to lay down and put my head on a pillow, and that was the end of it for the night. From there, I went back to him after a while. We had tried some other pills, and then he suggested the external vacuum pump. And as Dr. Islam said, it does work. The only problem is it's not very spontaneous. And the reality of it is that when you use it, your penis gets a little cold, it turns a little blue. And I would say it's not very inviting if you look at it for your spouse or your partner. And so I used that for about 3-4 months and ended up saying, okay, this is not working well, and went into a major depression. The intimacy in our lovemaking went away. Basically, I felt like I lost my manhood, and I just felt miserable and like, why go on? Well, that lasted for a whole year. So from the age of 58 to 59, I tried all these things. From 59 to 60, I was just in a bummer. Well, I got a letter from, from the doctor who did my surgery. And he says he has one of his gentlemen, one of the docs that works there, that takes care of ED. And I went to this meeting. And at that meeting, went with my wife. We found out about some of the other options that are available to fix it. The needle, I was not interested in. Not that I have a fear of needles. I just wasn't interested in using a needle. But the implant was something that my wife and I really looked at and talked about. I suggest very strongly that you take your partner with you when you go to speak to a prosthetic urologist, because ED really is not just a male issue. It's a partner's issue. And the more they know about it and why it's happening, the better off you are. I get lots of guys that I talk to that tell me, my wife thinks I'm having an affair, I don't love her anymore, and that's why we can't have sex. And that's the farthest thing from the truth. The problem is you can't get an erection, that's it. So basically what happened was, day after my 60th birthday, I had the 3-piece implant done. And I will tell you, that is the best second decision I ever made, because the first one was marrying my little lady. But that decision changed my life. It gave me back my manhood. It gave me back all of the sexual prowess I had when I was 18. Now, my wife, of course, didn't want an 18-year-old around. She wanted somebody her age. But the point was, it felt normal. It felt great. Recovery really wasn't bad at all. They will send you home with some pills. I have a pretty high threshold for pain, so I just took some Advils a few times a day, and that really took, excuse me, made everything very bearable. After 2 weeks, I went back to work. I had a desk job. After the 4th week, I went back to the doctor, and he showed me how to use the pump, and he said, go home, pump it up and release it a few times until you get used to it. That's really the one part that most guys are upset about, is when you start using it, it does hurt a little because there's something you're pushing on your scrotal skin. But you will find, after you do it 5 or 6 times, you'll find a sweet spot. And once you have that sweet spot, there's no pain. There's just the feeling of pressure on your scrotum. That's it. 8 to 15 squeezes of the bulb, and you have a rigid, solid erection that's good for any type of intercourse you want to have. And I will tell you that it is so rigid. And I wasn't sure how rigid it was, but one day I took a shower, and after I took the shower and dried myself off and stuff, I said, let's see how rigid this thing is. I pumped up, and I hung the towel on it, so I had a towel rack. That's how rigid the thing is. It is rigid. The thing that's nice about it is it looks totally natural for your partner. My wife has said many times, and many women have said to her, if she didn't know that I didn't have ED, she would not know that I had anything in my body that was not natural. It changes your life. It gives you back the intimacy that you lost. A couple things I will tell you about that, just so you know, going down the line, is if you wear boxer shorts while you're healing, you're going to want to wear jockeys to cradle your testes. If you sleep on your side, you're going to want to put a pillow between your legs, because if you smash your scrotum, you will not sleep. It does not go off at the airport when you walk through the metal detector, so you don't have to worry about that anymore. The other thing is, it doesn't stop you from getting any type of scans, MRIs, PET scans, CTs, or anything like that. It is the most natural thing. And the best thing about it is natural feeling of orgasm. Even though without prostate, you have no ejaculate, the feeling of the pumping of the ejaculate is there, and you have what's called a dry orgasm. And it is just as potent as if you actually were having an ejaculate. It's as simple as that. As my wife said, cleanup is a lot easier. But the reality is, this will last you a long time. My implant, my first one, lasted me 14 years. When I was 74, I went back to the doctor and said, it's not working anymore. He said, okay, what do you want to do? I said, pencil me in, I want another one. And 5 years ago, I got another one. So now I'm working on 5 years. I'm 79. This is my second one. If this lasts 14 years and I'm still around, I'll go again, because it makes you whole. Simple as that. And for people who aren't married or don't have spouses, at least it gives you the feeling that if you find someone you really like and you want to have intercourse with, but you can't because you because you have ED, this takes all of that away. So there's nothing that's negative about this. And I think about 98% of all women will say that this is the best thing that's happened to their relationship in a long time. So, Dr. Islam, I'll turn it back to you. If there's any questions, I'll be happy to answer any, if anybody has any. I'm sure they'll have some for you.
Thank you, Cliff. Thank you so much for sharing that with us. Okay, I am checking the chat box now, and I think we do have a few questions